I did it again. That's not the first time now I go without a microphone. Hey trippers, today I'm going to be talking to Craig Hannum. Craig is a military veteran. He's a suicide prevention educator, and he is the president of T3, the toughest topic. Stop saying Hey trippers, today I'm going to be talking to Craig Hannum. Craig's a military veteran. He's a suicide prevention expert and educator, and he's the president of T3, the toughest topic. Craig spent the last 15 years guiding people and organization through the conversations that matter the most, and that's primarily around mental health and suicide prevention. As an educator, he's been equipping people with the tools and the knowledge to approach these difficult topics with courage and empathy. His transformative work is breaking down barriers and saving lives. This episode will challenge and inspire you, offering valuable insights into resilience, education, and fostering genuine human connection. Let's get into it with Craig. I appreciate you. Welcome to Tripping Through Transformation. I'm your host, Guillaume Poirier, and I'm inviting you on a journey that will expand your outlook on life.
Balance makes it bang.
Join me as we delve into the realms of mental health, resilience, personal growth, community, and alternative healing. Through personal narratives and expert insights, we'll explore the transformative power of shared stories. Get ready to escape from narrow perceptions and dive into a world of diverse perspectives. Craig, welcome to Tripping Transformation, man.
What's up, brother? How you doing?
I'm doing great. Listen, before I hit record there, we were just talking about what you're doing at the school you're working at. So you're just to back up a little bit. You're Lewiston with Rubio, is that right?
Right. Yeah. Chris and I, we live 15 minutes apart, and where I work is Lewiston High School.
Yeah.
So, yeah.
How did you end up there? Did you just move there?
We moved here Labor Day 2023 from Tucson, Arizona. Mostly because my wife's daughter has been up here for going on 8 years. She's an associate professor at University of Idaho for animal science veterinarian, and she has her own veterinarian business. So, my wife's like, hey, I want to get up there and be closer to her. I'm like, let's go. And we came up on an October, 4 years ago, little road trip just to check it out because I've never seen the valley. And as soon as I hit this area, I was like, oh yeah, we're moving here. And the rest is history. It's been great. It's been night and day as far as quality of life. Better environment, better culture, better people. Yeah, I totally love it here.
Nice. So maybe I should tell the listeners and the viewers that you're a suicide prevention expert, and you've been doing it for a while, right? You started that when you were in the military?
Yeah, when I was still in uniform in 2010, I was stationed at Fort Huachuca, Arizona. We did not have a formal program in place, at least on the base. I reached out to folks that I knew that were in the mental health arena, and I asked them, I said, hey, do we have a suicide response plan? And they said, no. I said, all right, do we have a suicide prevention plan? Besides the mundane slideshow that was being used and just sent across the Army. And it was dry. It was like 90 slides long. It was ridiculous. And they said, no. I said, okay, if I have your support and I create policy, will you support me? And they're like, absolutely. So I wrote something up and took it to the commanding general. And he's like, I love it. You're in charge of it. I was like, okay, let's do this. And because it was getting bad. I was in charge of all law enforcement activities at the time on the base, and to include search and rescue and all that jazz. We dealt with the cartel coming across the southern border, human smuggling that would just break your heart. And then suicide. My guys were responding to suicide after suicide, and it was stressing them out. We didn't have a mechanism in place to help them. And I couldn't have them down. I needed them. Yeah. And I got that it was, they already have post-traumatic stress from combat. So we started getting more involved, and we started creating a program, if you will, on how to take care of the first responders. That's initially how it started. And then it started to build. And then it started to become a prevention tool. And then it was, hey, Craig, can you show up and intervene? So then it was like, how do we train first responders how to respond to a mental health distress? Because if someone's screaming in their house and that's all they're doing, that's not illegal. But we would treat suicidal behavior as a crime. That's why every time I do my teachings, man, I never say the word commit. Nobody commits suicide. You know what I mean? Rapists commit rape, murderers commit murder. Suicide's not criminal, so we got to get rid of that. That helps get rid of that stigma. And years go by, a few more, deployments and all that jazz. I retired in 2015, and they offered me the position of program manager for suicide prevention. And I worked my fourth point of contact off for 4 years straight to get to a zero suicide rate among 3 military bases that I was in charge of for the year of 2019.
Okay, man, that's okay. And from there, you ended up working with schools, which I'm gonna get to down the road. But
Yeah.
so you said that in 2010 you approached the military and asked them if they had a program for suicide prevention. 2010.
Yeah, and they say yes, they could check the block that we have something, but it was ineffective. It did not address the real issues of why somebody was feeling suicidal. It didn't deal with the prevention aspect. It dealt with here's the information, here's the phone numbers you can call, here's your resources. Have a nice day.
So it was like outsourced to like a third party.
They would have soldiers who have zero training, anything formal in this arena, basically proctor the class and just click the slides and read word from the slides. It's pathetic. It was 2.5 hours long, man. I'm
and
sorry.
that's how, that's how it had been handled for all the years previous or prior.
Yeah. It was like, oh, we got a system in place. We can say yes. If anybody asks, yes, we have a program. Yeah, there's a program, but it sucked.
Yeah. And then you were working with military police. Did I get that right?
Yeah. So I was military police. I started out in field artillery and reconnaissance and then switched over to military police and never looked back. And retired military police as a sergeant first class. I held positions as law enforcement operations, non-commissioned officer in charge, first sergeant operations, the gamut, team leader for SWAT teams, all kinds of stuff.
Yeah. Is that kind of like a transition role, like a military police, like from when you're a soldier, or how's that work?
So it's funny you asked that. I had this discussion with my wife the other night. We were talking about trauma and stuff like that. And it was the subject was military sexual assault trauma, because rape in the civilian world is one thing. Rape in the military, it's worse only because the person who's the aggressor, they're probably in the same unit. So it's a totally different arena of trauma. Well, her and I were talking about it. It reminded me of a court martial that I was testifying on. I was first on scene, and it was a very violent sexual assault. And I'm testifying. And a buddy of mine who was on the panel for the court martial, he's a command sergeant major. He's leaning forward as I'm testifying on the stand. And I kind of looked over because I'm like, okay, why is he leaning forward? And he's crying. He's got tears in his eyes. So afterwards, we meet up. He's like, hey, man, you want to go out for a beer? I was like, yeah, let's go. I was like, hey, man, why are you crying? He said, well, it hit me. I was like, what's that? He goes, well, we deployed together, right? I was like, yeah, which is true. We did a lot of deployments together. And he said, what I realized is military police, your deployments never stop. He's like, once you guys come back over here and you do the law enforcement aspect of your position, he goes, you're still immersed in violence. I was like, yeah. He's like, you're still carrying a weapon. You're still getting shot at, all that jazz. I said, yeah, that's true. Because there's 2 roles for military police typically. You deploy, and they use you however they want on the battlefield. The area of operations commander can pull a squad of MPs, say, hey, I need your expertise in quelling civil disturbance. I need it for POW operations, or I need you to help me do raids, or main supply route security, stuff like this. Because we go from investigations to K9. My K9 team's deployed with frequency. Then when you get back to the States, if you're working what's called a garrison environment, if all you do is law enforcement activity and search and rescue and all that jazz, that's the role. So he was spot on. So military police, unfortunately, they don't get much rest.
Yeah.
So I had to figure that out.
Yeah. I think for me, when I was picturing military police, I wasn't even thinking about being deployed. I was only thinking about being like on American soil, looking after a base. I didn't even think about, being like in another country and being a police officer. So you're still in active combat, essentially. You're just.
Essentially.
Yeah.
Yeah. And it's funny because there was a line from, remember that movie Jack Reacher with Tom Cruise, the first one? It was okay. It was entertaining. It was kind of far-fetched. The one line that was in that movie that was 100% accurate was when that civilian cop said, hey, you've done investigations? Yeah. Murders? Yeah. Rape? Yeah. What's the difference between you and me? He goes, everybody I busted were trained killers. So we had to be stronger, faster, and better. And we had to have more training because some of the guys that we took down, they're trained killers. They were soldiers. And a lot of them don't go down easy.
Okay. So I guess what I was trying to get at earlier when I was asking if military police is like a transitional role, I thought that maybe once you're a soldier and you've done combat and you wanted to do something a little less maybe violent, that you would become a
Yeah,
police officer. But it doesn't sound like that's the case at all. That's not how it works.
not
Eh?
at all. Yeah, and
Okay.
we could
Well,
get pulled. It's called a YS tasking, which is an individual tasking order. So that happened a lot with my canine teams. So like Delta
okay.
Force and Special Forces, they would call and say, "Hey, we need an explosive dog team." I
Hmm.
think my canine detachment for Huachuca was probably the most deployed across the Army.
Yeah.
And when 9/11 happened, we needed explosive dog handlers like crazy. And I actually lost one of my guys. He was serving with Delta Force, and he died in Afghanistan. So military police probably deploy to combat zones more than most non-support MOSs.
And do they get additional training or?
Expensive,
Yeah.
expensive. I've done FBI Academy twice. One for basic SWAT school. The other one was for chemical agents and weapons.
Yeah.
Um, we go through whatever state we're based in. We can attend all that cool state training for like state police. Done stuff with FBI, DEA, ATF, you name it. I would send my canine teams down to the southern border and assist customs in searching vehicles.
Okay. But you do get extensive training, but none of it is on how to handle crisis situation where people might be having a
Oh,
mental breakdown. Or
that's
do
the
you get
thing.
training?
A lot of it is, but not down to the minutia that we needed at the time.
Okay.
These guys are coming back with multiple deployments under their belt. Extensive periods away from family. I got a soldier in one day, and he was in the Army 6 years. I'm looking at his enlisted record brief. And on this side, on the left side, is deployment and training history. And over here is family related history. I saw that he's been married for 6 years and deployed for 5 years.
Hmm.
So I used to ask my soldiers when they signed in, they sat down in front of me for the first time, having a cup of coffee, and I would ask them, "How is your PTSD? Not do you have PTSD?" And I would always hear the same thing. "Oh, no, I don't have PTSD." I was like, "Oh, yes, you do. Post-traumatic stress is an unavoidable side effect to a profession of violence. So how are you doing with it? Let's get you squared away. Let's get you to the right doctor. You've got shrapnel in your body still. Let's get that fixed. Because in a year from now, I need you to run a squad. What do you say?"
Yeah.
And like they look at me like I'm weird. Like, what, you want to help me? Yeah. The culture of rub dirt on it and feel better, that's only applicable in the field. When we get back, I got to get your headspace and timing squared away. I need you focused. So when you respond to that crisis, you are just paying attention to the problem at hand. What do I need to do to fix it? How can I help you? Let me get you out of the situation and get you the help you needed. So I made sure that all my guys knew what that looked like. I would have them ride along with a patient that was having a mental health issue. So they knew how the intake process worked at the ER. So we had a face-to-face relationship with the ER staff, the charge nurse, the ER doctor, whoever, their mental health department. We knew each other by name. You could call ahead and say, "Hey, I'm bringing this guy in. Here's what we're looking at." Okay, cool. You would tell the person, "Hey, when we get to the hospital, you're not going to like it. We're going to put you in a paper gown. It's for safety. We don't know how far you're willing to take this. We're going to put you in a room that is so sterile, it's beyond uncomfortable. And they're going to put somebody in front of you sitting in a chair with a clipboard, annotating every single thing you do and don't do. You got to be prepared for that." So we started doing that training. And then I sent my guys to more behavioral health training, negotiator, how to be a good negotiator, not just talking somebody down from a hostage crisis, but talking somebody down when they have a gun, attached to their head, if you will,
Yeah.
how to get them out of that situation. And they would say, "Oh my God, you saved my life." No, no. Oh, I gave you the tools. You did the action. I just guided you through this process. Like
Yeah.
your title of your stuff, Tripping Through Transformation. I'm transforming you from this mindset to let's look ahead.
Yeah.
This is a permanent solution to a temporary problem.
Yeah.
Let's
Well,
fix this.
yeah. Well, I'm definitely going to be asking you about the changes that you implemented when you created your program, but I just want to really kind of paint a clear picture first of like the situation that these officers are facing, because it sounds to me like they already have their own issues, PTSD, right? They're
Yeah.
in a war zone conflict and they're dealing with other people that have PTSD and they're trying to help them cope. So that sounds like a very challenging situation right there.
Oh yeah. Yeah. You have to take your problems, and I would tell my guys, hold on to them, because you might need to not compare, but relate. So when I would teach my guys and train them, like I still train people today, I would say, "Hey, if you've got like experience, ask them, can I tell you a similar story on how I got through something like this? Can I share that with you? Because you don't want to make the conversation about you, because then that's an ego thing.
Right.
And I would tell guys, if your ego has low self-esteem, don't talk to someone suicidal. You're just going to make it all about you.
Yeah.
So when you relate, that's empathy, because sympathy is dangerous. Sympathy is, oh, you poor thing, that sucks, I'm out. Sucks to be you. But empathy allows you to stay in that moment and say, look, here's what happened with me. And it was stressful and I was scared.
Yeah.
And when you say that out loud to another person, especially if it's man to man, when you say, look, man, I was scared.
Yeah.
I wasn't sure where I was going to go with this action. Everything I would leave behind. And then one guy said, well, what would you leave behind? I was like, doubt and uncertainty. And my family would never, my friends, my fellow soldiers, if I had taken, and I'm not saying I was suicidal, but you always got to tell them that if I had taken my own life, I'm never going to be able to answer that question, why did you do it? And I've had guys tell me right before they've done it, right in front of me, why they were doing it. But brother, to this day, I still have no idea why. I've read hundreds of notes, but we truly will never understand why they did it. I didn't know him, but the guy that kind of started this whole thing with this circle of friends with Jim Gingrich, and I've, I talked to Cindy many times, and last time I talked to her, I was like, we will never know why. So stop trying to answer. It's just going to make you insane.
Yeah.
So when you put that kind of forethought to them, so they're actually looking ahead saying, okay, you're right. And the stigma behind it, it would make people feel weak, like undeserving. Okay, if I go away for treatment, am I still going to be a leader in the military? Am I going to be the leader in my household? Am I going to be respected? All these things. With men, the biggest worry was, will I be respected? With women, it was, will I be loved? Those are two things that kind of drive each gender, if you will. And it was like, hey, man, you asking for help, that's the strength. You called me to come here to help you. That's the strength. Yeah. You told officers, call Craig or whatever it might have been. And that's great. And I taught that same principle to all those bases that I was in charge of. I was in charge of 3. So I taught E5s and above, sergeant and above for the U.S. Army, on how to do the exact same thing I was doing so that they were my first responders on those bases. And it worked, because it's, in my opinion, the only way we're going to get rid of suicide, and it may never go away, but the only way we're going to curb it and reduce the numbers is through education and allowing us just to have a conversation. I would tell providers, first thing they would do, they'd pull out the Columbia survey, the standard survey to figure out how suicidal you are. That's the first thing they would do. They would sit a dude down who's stressed out. And I'm like, what are you doing? No, talk to him. All the questions you have that you need to put on that paper, you're going to get in that conversation. Just let them tell their story. Yeah. Be shocked with what they tell you and what's going on in their life. That's what I teach.
Yeah, you just brought up something that I was going to ask you later on, but I'll just bring it up now, seeing as you brought it. You're talking about how there's like a standard for how suicidal you are. So there's like an evaluation.
Yeah, that's
so
called
there's like a spectrum of suicidal.
Yeah, and there's a few out there. And I kid you not, when I was my first year as the program manager, I'm on probation, and that's standard for all brand new Army civilians. And I only thing I asked my director was, I want autonomy and I want a good budget. He's like, it's yours. I said, great. So I just paid attention. I was just watching what was going on. I was getting feedback with the presentation that I use today still. That presentation I created back in the final one was 2018. I used the same one today because it's still applicable to almost every audience. But it took 2.5 years to get there. And I kept getting feedback. So on day 366, I had a stack of policy letters where I was going to implement change. And I already had the commanding general of the base at the time sign off on them. The first department that gave me flack was mental health. Called me right away. Said, you don't tell us how to run our department, and you're not a counselor. And I was just getting berated over the phone. I'm just listening. I'm like, all right, go ahead, hit me. What do you got? You can't tell us what to do. We're not going to be on call, yada, yada, yada. And you can't diagnose. I was like, you are 100% correct. I'm not a counselor. I can't diagnose. I can't prescribe. I said, but you will have a mental health professional on call 24/7. I said, I just want to do this radical thing called work together. Let's just try that. Yeah. I said, what you guys see is what presents to the ER. I got in a car accident. My leg is broke. I'm in the ER. Okay. I said, but you didn't see what happened to that point. I said, so you don't get to see what happened out there in the field that brought them to your office Monday through Friday, 9 to 5. So the first call out we had, so my suicide response team consisted of myself, my risk reduction coordinator, Scott Hatfield, brilliant guy, a family advocate, Alitra was her name, then a mental health professional, and a chaplain. So when I got the call, I rallied up the troops. We all showed up. I might have been there first, and the guys will show up after. The first time we called out the entire team, we had a guy who was ready to kill himself. He had a pistol. He had just gone through, he just found out he was going to get divorced. The wife couldn't handle the deployments anymore. So that's the other part that, people don't see. And he was serious. I had medics down the street. I had a SWAT team lined up because he was armed. And I said, all right, I'm going to go inside and talk to this guy. And when they saw me bring him out and saw the distress that was going on in this kid's face, that's when they realized, okay, we've got to do better.
Yeah.
And it worked.
Yeah. See, I think in a case like that, it's clear that the guy is suicidal. Like he's in the process of attempting to take his life. But
yeah, he was active.
This kind of gets a little bit personal for me. And I think you've mentioned yourself before that you've been depressed, but you yourself have never been suicidal. Did I get that right? And I feel like
100%, man.
No, I just feel like I'm in the same boat, but I never know. I never knew because, again, is there a definition for what it means to be suicidal? Like what defines a person as suicidal? Do they actually have to have like a gun to their head, or can they just have the thoughts, intrusive thoughts in their minds,
Exactly. That's what it is. It can start with thoughts or ideations, a gesture, perhaps. Like if you said something like, and this is where we have to really pay attention. If someone's walking along, whatever, and they're close to you within work, business, whatever it might be, family, they say, oh my God, I can't take this anymore. Does that mean they're suicidal? We don't know. That's why I say, ask the question. Okay, what do you mean by that? I'm frustrated. Oh, okay. So you're just frustrated. That's all? Yeah. Or what did you mean by that? Meaning I can't do this crap anymore and I want to kill myself. Boom. Ideation. Right there. Immediately. That's when we get involved. That's when we should get involved. That's when parents should sit them down at the table, because this discussion with their kid is going to be tougher than sex.
Yeah.
What do you mean by that? What's going on? Talk to me. Let them vent. Let them be pissed off. Let them cuss. I had a lieutenant colonel say, he's cussing at me and being disrespectful. I was like, he's just cussing? Yeah, that's not disrespect. He's pissed off. Let him vent. Are you that thin-skinned? Are you kidding me? The kid is freaking in duress, man. Let him vent. Let him explode. If he's not being violent with you and he's just pissed, let him get past that. And then sit down and just be rational and calm. Say, all right, why do you want to kill yourself? Well, I'm not going to get promoted. I'm being kicked out of the military. I got in trouble. My wife found out that I was cheating on her, things like this. The twist is, and this is where it gets complicated, is you got to make sure you put the accountability back on the individual who feels like this. Yeah. Because everything around them, brother, these are all the external factors and contributing factors that are invading your headspace. It's your actions through your heart and mind that determine what am I going to do. And 9 times out of 10, that situation you want to off yourself for, you create it. And it just got bigger and bigger and bigger and festered and got to the point where you just couldn't handle it anymore. And everybody has a breaking point in life. But yes, I tell people, if you walk through life never depressed, you're not paying attention. I've had several moments of depression. I just had my 12th surgery, the 3rd one on my back, hopefully the last. And it's been a long road. So I've been in incredible pain since 2014, multiple injuries, So at one point, had an injury to the back of the head, couldn't walk, couldn't see. I was in a wheelchair for about 3 months. And I was at that tipping point in my career right before my 15th year. And it was depressing. It really was. Yeah. And getting through it was rough. In fact, when we figured out what was going on with my head, with the vertigo and getting all that squared away, they said, all right, we got to do physical therapy to teach you how to walk again. And they said that I was the equivalent of an 85-year-old man whose legs don't work very well. And I was like, wow. So the physical therapist said, okay, we'll do physical therapy once a week. I was like, nope, 5 days a week. He's like, it's going to be painful. I was like, yeah, I know. But I'm stubborn. And I was not going to accept a medical retirement. I wasn't done. Yeah. I was determined to make it to that 20-year mark and earn that retirement. But I had good people around me that helped me persevere. So no, I was never suicidal because my ethos was not to quit.
Right. And that's kind of where I want to get into. So in the example that you gave earlier, that kid literally said, like, I want to kill myself or I want to die or something like that. So I want to kind of share just my own personal story. So like, you know, after losing my house and all that stuff, there was a point where I was definitely wishing that, you know, or not wishing, I shouldn't say wishing. I had thought that if I crossed the road and a bus was to hit me, I wouldn't, I would have been okay with it. You know what I mean? Um, I was dating a girl at the time who would take sleeping pills, and occasionally I would think, oh, maybe one day I could just go to the pharmacist and pick up her prescription. They won't know it's I'm picking up for myself, and I'll just take the pills myself. But in the
Yeah.
back of my mind, I knew that like I could never take my life. Like it just didn't, it felt wrong. And
Yeah.
I've come to think, at least, that the reason that I felt that way is because I always had a purpose still. Like I still had to be there for my kids. And kind of like you weren't ready to quit yet. And so I've always questioned, was I suicidal in that period of time or not? Like, I don't know what the definition is. And do you think that that's kind of what leads people to think about suicide, is when they lose hope, they lose purpose, they don't have like a reason to go on?
Right there, man. The key word, hope. When they surrender to hopelessness and helplessness, that's where on that tipping point. You know, that's where it's just so overwhelming, and we can't see the light at the end of the tunnel. And when people say it's going to be okay, you're like, freaking when, where, how?
Yeah.
You know, you say it's going to be okay, but it's still my problem. You know, so yeah, so then you have that ideation. So does it mean you were suicidal? No. Was there a thought there? Perhaps. You know, that's the edge of depression. And I'm not talking clinical depression, you know, where it's diagnosed and you need medication to sustain life. We're talking about those moments of depression and sadness where it's just so much, and there's all these things that are happening. But like you said, you still have purpose. There's people who depended on you. That's the stuff that I use when I'm intervening and talking people down. I will use all those good things in their life currently that give them self-worth and say, hey, here's what we need to focus on. I had a soldier who he got injured pretty bad. Young guy, had 3 kids, married, and the Army was going to retire him medically. Now, for some, they're like, great, this is awesome, because that's the paycheck I'm going to get for the rest of my life. But then you don't get those benefits that the Veterans Affairs offers. So you're basically kicked to the wind. He didn't want that, but he couldn't pass the PT test, and he couldn't pass fit for duty standards. So it was better to give him that medical retirement. So it's an honorable retirement, all that jazz. But he was pissed. He thought he was being just put in the corner and forgotten by his chain of command. But they have a standard and they have to uphold regulations. So I get the call, and I did something very unorthodox on this one. Because normally, if I have my phone on me, I'll tell them, hey, I need to make a phone call to let these people know that I'm going to be late so I can take care of you. And what that just told them is, you are the most important thing to me right now, period. This means nothing. I pulled my phone out, and he's like, because he knew me, because he's been through my training. He's like, you're making a phone call? I was like, no. Before I walked in, the wife was there at the incident command site. I said, text me pictures of you, the kids, all girls. And he had a German Shepherd that he loved big time. And we actually took that dog down the road. This is, down the road. We took that dog, sent him and the dog to training. So that dog became his emotional support and therapy dog. So it was dual-hatted dog. So it took care of him. So when he started to feel the anxiety from PTSD, the dog knew exactly what to do. Yeah. Right. So I walked in, and he says, I can't believe you're pulling your phone out, Craig. I was like, yeah, you say you're going to kill yourself? You have nothing to live for? I was like, what about her? That's why your daughter. I just kept doing this, staring. He's holding a pistol in his hand. Right. I said, oh, there's your wife. Oh, hey, look, man, beautiful German Shepherd, man. Oh, well. So what are we doing? He's like, please take this gun from me. I was like, you got it. So you have to find what gives them purpose. You did it by yourself, Guy. You knew who needed you still.
Well, for me, it was easy. For me, it was, if it's not me, it's nobody. And these girls are going to perish on their own, or they're going to be left to their own demise, So I just couldn't do it. Like, to me, there was no choice. It was, you got to push through. And luckily, like, I was able to push through, and I'm doing a lot better now. But I think I was really fortunate to have my children, because they're what carried me through. Yeah.
Well, because here's where it gets serious, Guy. The thought is one thing. If you give me a room of people, 1 in 10 have the thought, according to the stats. And sadly, it's starting to get lower. It's looking like more like 1 in 6, 1 in 8. It just depends on the demographic and age group. So they're thinking about it. It doesn't mean they're acting. So say you had the thought, right? Where we have to get involved, and this is the tipping point is, are you suicidal? Yes. Okay, cool. Do you have a plan? You know, this happens in the conversation. I don't go through a checklist. I have it in my mind, but I'm going through just normal dialogue with somebody. So, okay, did you have a plan on how you would do this? And
Yeah.
I said, well, yes. Okay, what is it? Well, I'm going to hang myself. Okay, how? That's where I make them very uncomfortable because I want them to describe how they are going to die. And you should see the look on their face. And I was told by a psychologist, you don't do that because you're putting the thought in their mind. No, I'm not. I'm identifying it. The thought's already there. It's their thought, not my thought.
Yeah.
I'm just trying to understand. And if they say, here's how we do it, okay, cool. And now I understand. Let's keep you separated from the means. And that's important. Like if they say it's a gun, one guy said he's going to drive his truck into oncoming traffic, you know, so we took his keys. You know, you remove the means. Now, if they say, I don't have a plan, that's good. That's just a thought. Because what we don't want people to do is have a plan, have access to that plan, and then move forward with the plan. And I can tell you this much, man. The people who have attempted that I've been there saving, doing first aid, CPR, whatever it might be, 100% of the time they say, Craig, please help me. I don't want to die.
Yeah.
We know scientifically and psychologically, nobody truly wants to die.
Yeah. I mean, you brought up like the rope thing, and that kind of brought back memories for me because when I worked in oil and gas, you know, there's catwalks that are 40, 50 feet up in the air, and it's very common to see a rope hanging because people are using the ropes to lift tools and stuff like that. And during my dark times, I would see a rope, and sometimes I think, you know, I could probably climb up that ladder, jump. But then what would come to mind after is, what if I don't die and I'm paralyzed, and now my kids have to look after me for the rest of my life in a wheelchair? I didn't want to give that life to my kids. And that, again, that's what kind of stopped me from going through with it. Like, I didn't want to suffer by botching it. So I don't know if that's, I don't know.
No,
that's
it's good.
In my mind,
it's good. And see, the fact that you can talk about it right now and you're okay. Yeah. It's like, ooh, that was a dark time in my life. Was a dark time in your life. That's
100%.
That's where we help people move forward. It was a dark time in your life.
Yeah.
It's not now. You survived. Well done.
Yeah. Obviously I want to touch on to like the program that you created that helped change things and how, you know, the military addresses suicide prevention. But before we talk a lot about PTSD, do you have a definition for that? Or can you tell me what PTSD is? Is there a concrete thing?
Yeah. So, you know, post-traumatic stress disorder, it's real. And anybody can have trauma. It's not just military personnel, first responders, law enforcement, etc. A child, say a child 6 or 7 years old, remembers grandma dying. That's traumatic for them. It's rare that you can go through life, you know, up to a certain age and never experience some kind of trauma, whether it's your first puppy, the hamster, you know, age appropriate, you lose a loved one, we're getting older. My best friend got in a car accident and she died. Oh man, that's traumatic. You know, all these things that are happening as we get older, the trauma gets thicker. Does that make sense? So what I like to focus on and what's part of my program is post-traumatic growth. And that's why I tell people, especially people in the first responder arena and military, that it's an unavoidable side effect to professional violence. So you need to be ready for it because it's going to happen. So when people deny and say, no, I don't, they're lying. There's no way. They're hiding it. But if you speak out and say, yes, of course, I've got post-traumatic stress. Now, I don't use the disorder word, not to eliminate language, but that connotation of that word reinforces the stigma that we're trying to break down. So I would say post-traumatic growth. And I say, hey, it's not a disorder. It's an injury. It's a mental injury. And it has physiological side effects if we don't learn how to control it. I had to figure out my ways to deal with the bad dreams, etc. And I share that with people, say, hey, give this a try it. See if it works for you. If it doesn't, let's try something else. Let's try not to use psychotropic drugs. Now, I'm not speaking against pharmaceutical companies because there's medications out there that sustain life, but we don't always need a pill to suppress thoughts. That's the problem. We should be able to talk about those thoughts openly without judgment. That's why I focus T3 on teaching people how to have a conversation. And it's really easy because you're not judging. You're just talking. How are you doing, man? I've talked to guys like, hey, you want to go get a beer? And I'm really careful with that because if I know they're on the cusp of alcoholism, no, we're not going to go out for a beer. And then figure out that unique coping mechanism for them that might be similar for many people. But if it works for you, great, because it's unique to you. Your trauma is unique to you. And each one is a little different. It might be similar in the textbook. And, you know, if we did stats, if you want to check everything out, this guy has trauma because of a car accident. This guy has trauma because of combat, yada, yada, yada. But each person has a very unique way in responding to the trigger. And I love it when people say, you're triggering me. Yes, I am. You need to know how to respond to your trigger. And I use my own experience so they understand where I'm coming from.
Yeah.
Mine is the smell of burning hair, man.
Mm-hmm.
Because when there's explosion stuff or whatever might be happening, the first thing I would smell was the burning hair. You know, so I worked with a brilliant psychologist. Say, hey, help me interpret this into an education model. He said, no problem. So here's what we came up with. Your emotional state at the time that you're exposed to your trigger will dictate how you respond to it. Case in point, say you and I, okay, let's say Neil Peart is not dead. And you and I are getting ready to go see a Rush concert. We're in a good mood, man. So we got our ladies with us and we're in the hotel room and they're burning and curling their hair to look Rush perfect because we can't wait to get out there and see these guys, man. You know, the Dangerous Three, the Three Blind Mice, the trilogy of Trespassers, whatever you want to call them. We're pumped. I get an odor of my wife curling her hair. I'm probably not going to react. I'm just going to separate. Why? Because I'm in a good mood. Let's flip the script. We're now getting ready for a funeral and I get exposed to that odor. Emotionally, I'm already compromised because I'm sad. I'm in shock. I can't believe this happened, kind of thing. So once again, your emotional state will dictate how you respond to it. So we need to know how to respond to it. I'm not saying go out there and create trauma to practice. You've got to do that in the moment. You know what I mean? You know, I had one guy say, so should I go like get a bunch of hair and put it in the fire? No, dude, no, man, no. That's not what I mean. That's not the kind of training I'm talking about. I'm talking about emotionally and mentally usually happens in the moment. It's not, okay, it's Monday morning. Mondays usually suck. So let me just prepare myself for a crappy Monday. No, we don't know that. We have no idea what we're going to be exposed to. Go through life with no expectations. Usually you'll have less disappointments. But if you're exposed to something that's traumatic to you because of past experiences, how are you going to deal with it? Are you going to lose it and scream, sit in the corner, cry and drool? Or are you going to be like, okay, that sucked. I need to talk to somebody. Just, hey, man, call. Hey, I need to get this out. Cool. Before I start my day or before I complete my day or whatever, I need to get this out. Can I have an ear? Sometimes that's all people need. It's another thing that's embedded in the training is validating people's feelings. The way we used to approach this, man, was why would you think like that? Now, asking that question in that way basically says, you're an idiot. Why would you think like that? No, man, we had to change that. We totally changed how we approach it and say, why are you feeling like this? Mm-hmm. Tell me why. Have that empathy.
100%.
You know,
I was going to say, so is it fair to say that PTSD, because it's in the name post-traumatic, so is it safe to say that it's unhealed or unprocessed trauma? Like it's not itself a physical injury. It could be the result of a physical injury. Like, you know, you're working near a turbine and you get your arm caught and it rips your arm off. Yeah, that's traumatic, but it's not the injury itself. It's how you process the event in your mind, right?
Exactly.
Is that fair to say?
After the fact.
So is it fair to say then that if someone learns to process it, it can be healed? Like, is there a cure for PTSD? Or do you just learn to kind of cope with it so that it doesn't?
Yeah, I wouldn't say there's a cure because my worst dreams are from stuff I was involved in from 1997 to 1999.
Okay.
Okay. And that's another thing I tell people. Trauma does not age. You know, so anything that happens, it's everything after the fact, you know, the post. You can prepare yourself as much as you want to. I used to tell my guys, our plans are perfect. They're like, what? I said, oh, yeah, we write these plans down for what this combat mission or this raid for SWAT and hitting this drug dealer, whatever it is perfect until we execute.
Right.
That's life. You can prepare yourself all you want. Yeah, all your experience is great. But we have no idea what's going to happen because all this other stuff that's out there, there's other people we're dealing with. We didn't tell the bad guys what we're going to do, so they're ready, so they understand what's going on. We just don't do that. Yeah. It's everything after the fact. So that's when we need that resiliency training to prepare our psyche to get the mind and have the heart and the mind in union, because there's between 50 to 60,000 neurons in the heart directly tied to emotion in the brain. Oh. So we got to find that balance.
Yeah.
You know, I'm not saying be sterile. Like if you're in a profession of violence, don't be sterile, be human, you know, but be prepared. So I would tell my guys, especially if it was like their first deployment, I'd be briefing new soldiers going, hey, you're going to be in harm's way. You need to prepare yourself for that.
Yeah.
The physical is easy. that it's 90% mental, 10% physical. I know we say that a lot with a lot of things, a lot of walks of life, but it's absolutely true. The physical part's easy. Making sure that your mind and your heart are in unison, that's the challenge. And preparing them for that is you tell them the truth. Don't sugarcoat it. Don't say, yeah, nothing may happen to you. You'll probably be okay. You're in a support role, whatever. You don't say that. You don't tell a rookie police officer or a rookie EMT, you may not see anything today. No, that might be the worst day in your career. You'll look back and going, yeah, my worst day as being a cop was my first day as a rookie. Here's what happened. And then you use that to say, this is not as bad as that one thing was. And that's what I'll tell people. I'll say, hey, now you are now stronger. Like you, for example, Guy, quite honestly, you are now stronger emotionally, psychologically, mentally. You probably found that unison between, mind and heart. And people say, oh, you're doing some weird new age science on me. So, no, I'm not. It's just, we didn't discover that there were neurons in the heart until, a few decades ago. Now we understand when someone says they died of a broken heart. Yep, they probably did. If someone's married for 75 years and that was their first and only love, that's why we always see when say the wife passes, not shortly after the husband passes, because they're lonely. It's a broken heart. Loneliness is part of one of the triggers of suicidal behavior. When they feel like they have nobody in their lives, give people a chance. If it's a stranger, I'll talk to him. I kid you not. I could care less. Hi, I'm Craig. What's up? I've noticed that you've been staring at that broccoli for a while. You all right, man?
Yeah.
They're like, no, I'm not. What hi. You want to walk around and talk? Sure. You just, and that's why I try to train people is how to pick up on those subtle indicators, because that's the hard part, man. The obvious indicators, those are easy to see. It's the stuff that we hide. And oh man, humans, we are good at hiding our feelings.
Yeah. What you just said there about feeling lonely, I didn't realize it till you just said it, that during my lowest time, those were also the times I felt the loneliest. Like I was all by myself in the world and there was no help. So, so I want to get into now. So what did you change with your program in the military, and what's T3? And I want to hear about the talks you're giving and how you're working with schools now. Like how'd that all happen? Like the transition. I want to hear about all about it.
Yeah, I did it for 4 years as a program manager. Effect change. It was successful, well-oiled machine, and it's still being used today, which is great. And it's all about just changing the paradigm, just getting rid of mundane slideshows. But the hard part is you have to have a passionate person in that position, to keep it going. So I don't know if the person who took over my position is doing it or not. I don't know. I've heard, horror stories that they're not. That breaks my heart. And I can only control what I can control. So I created T3 because it's in a need. And I had somebody tell me the other day, hey, how much do you charge? Is there a fee? I said, yeah, I only charge a fee when I teach classes. And it's $50 per person. They're like, that's it? I'm like, yeah. They're like, well, you could charge more. I could. Why would I? I'm employed. I'm okay. I'm doing this just out of benevolence because it's a need. The goal is to reduce suicidal behavior in rural North America. I'm going after rural because there's two causalities with rural areas. One, especially like in Alberta. Actually, how about this? All of Canada is a very rural area. Forget the city center. So I don't focus on city center in North America because plenty of services available just down the block. They're all huddled together. In rural areas, it might take you, we'll see you in 2 to 3 days. Well, my problem is now, or you have to drive hours, take time off work, and that's another problem. The other causality is rural North America is heavy with a blue-collar demographic. And let's be honest, men with calloused hands, bearded out, working in the elements, don't talk about feelings around the dinner table.
That's true.
And I had a guy admit that to me today. He came in to talk about his daughter. He had his wife with him. And when I made that comment, he looked right at me. I was like, you don't talk about feelings, do you? He's like, no. I said, that's what we got to change, man. Mm-hmm. I said, because you do feel. I mean, I get it. We try to put on the tough guy persona, so that's one thing I change, especially in the military. And if I could get soldiers to open up, I know I can make this, work. And the guys that I've been teaching up in Canada, it's been successful. 3 times last summer, it's working, because people are communicating. A good friend of mine, remember Daryl McAvina? I taught his executive staff, his high leaders. And they have a better culture of understanding what's going on with their guys out there in the field. Hey, are you okay? Talk to me. What's up? because they're just paying attention. They're just talking. And just hearing somebody's story and allowing somebody to tell that story, that's refreshing, because they say, you know what? I think I feel better. Okay. Are you sure? Yeah, 100%. Call me whenever. That's the other thing. You got to be approachable and you got to be available. So that's how I changed in the military, to take that culture of, hey, when we're deployed, that's one thing. We got a mission to take care of. We're in harm's way. We're in a hot spot. We're in a war zone, whatever. And the focus has to be direct on that. I got that. When we get back to the rear, back to the States, it's time to get the head back where it needs to be. We call it the head, space, and timing. Having the head and the heart back in unison, so we don't have domestic violence issues, substance abuse issues, guys drinking themselves into a stupor, guys looking to replace the adrenaline of the battlefield with something dangerous, because they have that need to replace that adrenaline, because there is adrenaline when you're in a firefight. Truly, there's nothing more exciting than being shot at without consequence, and you want to replace that void. So they take up a high risk behavior, and it creates other problems. So watching out for your folks, because we can't deploy without personnel. We can't have emergency medical response guys without them. We can't have cops without them. So if they need to take a knee, take a knee. If you need help, call me. I always tell people, man, let me know, reach out to me. I will definitely help out.
Yeah.
Now, the other thing I do with this is unique, is every time I teach a class, they get 4 additional weeks of training, where I email anybody who wants to be involved a scenario that in a 4-week period progresses. And I'll ask basic questions. What are you seeing with this person? What would you recommend at this point? And it goes where it basically takes a platoon of soldiers that deployed to Japan in 2011 after the tsunami. Their job was human remains recovery. All these guys had combat experience. Every one of them had search and rescue experience. So they were sending a killer team. 3 months later, they get back. They were jacked up. The post-traumatic stress was through the roof. They seeing babies mangled and splintered, seeing bodies, just swollen from seawater, crushed, body parts here, body parts there, and having to recover that and try to piece it together and get it to the guys who can figure out who's who and give the families rest, so they can do what they got to do. It messed them up. I used that situation, and with the questions I ask on what are you seeing? And it forces that person who took the class to say, oh, I remember that part. And the reason why I do it is to reinforce what they learned in a 45 to 60-minute period, because it's perishable. And that's why I only keep it that long, because after 60 minutes, you lose your audience, And we know that through a presentation, 8 to 10 weeks after, 70% will forget. And that's what I'm trying to prevent, is don't forget this. And you always have an outlet with me. Hey, I got a question. I got a situation. What do you think? Yeah, I'll help you out. And that's the only time I'll get paid. I never charge for intervening like some folks do. I got a colleague who will say, Zell me $250 before we get started. And when he told this story, I called him an idiot. I was like, you're a tool, man. He's like, why? I said, you said Zell me $250. He's like, yeah, those are my fees. I said, okay, let me ask you, what was his problem? What was his contributing factor to suicidal behavior? He's like, oh, financial problems. I'm like, dude.
That's what was going through my mind when you were saying that. I was like, what if the guy's broke?
Why would you do that, man? Just talk to the guy.
Yeah.
It's a phone call. It's not costing you anything but time.
Yeah.
And if it's in the middle of the night, oh, I didn't get a full night's rest. Oh, you poor thing. This guy's ready to blow his head off with a shotgun and you lost 2 hours of sleep. I'm so sorry. It's like, why'd you get in the field? So that's what I like to focus on, is I do offer the education aspect. And it's not this high-end, ridiculous questionnaire. It's something that happened to a group of soldiers in real time.
Yeah.
They went through this transition. People go through a transition. Any workforce will go through a transition. Any company, organization, law enforcement agency, fire department, and the ones that are at risk the most right now are young kids, because they're entering into an economy in North America that, man, it's been in turmoil for a minute.
I know, it's scary out there. Yeah, my kids are scared of the future. They don't want to take on student debts. They think housing's too expensive. Like, it's a scary world out there for them. I could see that. So I'm guessing, is that part of the reason that you transitioned, or maybe not transitioned, but that you're also working with youth now?
That's actually, that's a funny story. The principal reached out to me and he's like, hey, do you have a teaching certificate in mathematics? I was like, no, but I've got a master's degree. He's like, well, the state of Idaho requires a certificate. I was like, oh, well, that sucks, you know? And he said, however, I'm working a new program where he's bringing on like safety officers to augment the school resource officer, which is the actually on-duty police officer. I said, oh, I'm curious, because he wanted to, really build it into something that is more of a positive face to the kids on, hey, this is a helping hand. How can we help you? Da, da, da. And it is morphing into that. And when one of the teachers found out my background, she said, hey, I'm teaching a class about relationships, and it's for like the juniors and seniors, and the kids love it. She goes, your stuff would be perfect for my class. Can you present it? Sure. And the classes here are an hour and a half each. We have an A day and a B day to cover all the subjects. And the first time I did it, it was well received. It really opened up their eyes. They're looking around at each other and they're paying attention. And one of the questions I say is, hey, are you required to like everybody in your class? And, the kids are like, no. I said, there's probably people in here that you don't like. And they're like, yeah. I said, let's be honest. I said, that's human nature. You're not required to. And they're like, what do you mean we're not required to? I said, no, you're not. You're required to be respectful, and work together as a team. Don't be a bully. And they're like, yeah, we agree. I said, but however, what if the person that you might be looking at right now that you don't like in this class is not here tomorrow? And when you found out they took their own life, how would you feel? And it was unanimous. They're like, guilty, horrible, pathetic, a jerk. I was like, yeah. I said, so you don't have to like each other, but if the person you don't like came to you and said, hey, can I talk to you? I need help. I'm scared with something. I need to talk to you.
Yeah.
I said, would you turn them away? And they're like, no. So once we realized that it was really working, we kept doing more. And the 4 that I brought on thus far has created that peer culture where these guys are actually watching out for each other. And if there's something that is major and they're listening to that conversation, they bring it to staff. They'll come to me and say, Craig, I need your help. I got somebody who's in distress. They're in the corner right now crying. Okay, cool. Let's go.
Yeah.
Or they walk up during lunch, before or after class. Hey, can I talk to you? Sure. And then I create communication to be transparent. So anytime we have an issue with the kids, whoever their counselor is, they're getting the same information. So we have that continuity of care. And it's just about having that open conversation. And I always tell them, I said, you guys got to report it to somebody else. Don't keep it to yourself. That's dangerous. You don't have that right. You have to inform someone, parents, staff, a teacher, whoever. Now, the double-edged sword with that is don't blast that out on Facebook. Don't put it on social media. That's not what I mean. Right. But it's not a classified conversation. And that's how it was treated because of stigma, especially in the military. Because if I come forward and say, I am struggling, you're going to suspend my security clearance. You're going to put me on some kind of medication that I'm required to take. You're going to make me see a psychologist. I'm not going to be deployable ready. I'm not going to be with my guys. I'm going to be looked at as a weak person.
Right.
And that's what I stopped. I was like, it's not weakness if someone comes forward. That is absolute strength, because it takes a lot to say, I am struggling. I need help.
Right. So when you're giving these talks or when you're teaching these classes, is your focus on helping people that are struggling cope, or is it more on detecting other people struggling, like on responding to what you're witnessing around you?
All of the above. Because every class I've ever taught, every single one since I started this whole thing, I always have someone who comes up to me after saying, do you have time to sit down and talk? I'm like, yeah, what's up? So it could be in the moment. So I teach them how to do all of it, how to have coping skills themselves. Like I said, 1 in 10 are thinking about it, especially in that age group between 12 and 18, 1 in 10 people. And then it goes from 36 to 54. Now we're getting into the post-war generation. My generation is going to be the next post-war generation, because we're at that silver tsunami where the baby boomers are in their last year of work, and they're definitely going to be retired. Who's going to take over those positions? So we have all these stressors, but yeah, so it's in the moment, and you got to see it in action. It's really cool. People, when they realize that they have a safe place to talk, they will. Even the ones that are most timid. I've had kids come up and say, hey, my friend, she's very, very shy, and she's scared to even say the words. Can you talk to her? I'm like, yeah. And I'd look and I'd talk and just figure out what's going on inside their mind. I would say, you're thinking about suicide, aren't you? And when you say that to somebody, their eyes actually open up, and they'll be like, you saw that? I'm like, yeah. I said, I saw it. I can hear it. I said, you're feeling it. I said, I see it. That's what I'm trying to teach people, is how to recognize that subtle mannerism, if you will, that subtle behavior. When one kid said, oh, anybody, so he raises his hand, he goes, so all shy people are suicidal? I was like, no, that's not what I said. I said, but thanks for asking that. I said, you're illustrating the point. Your perception is never their reality. Always remember that. What they're going through is not necessarily what we're seeing. The battle of the mind, that minefield, when we're talking about anxiety and doubt and fear, we don't see that, but we have to allow people to feel safe to talk about it without being judged. And that's what I teach.
100%. I see we're getting close to an hour, Craig. I don't know. Is there something
already?
that you,
Wow.
Yeah, I know. Right. So I guess my next question for you would be, is there any advice or something that you really want to put out there to the listeners that would be beneficial, whether it's somebody who's struggling themselves or if they know someone who's struggling? Like, is there anything you want to leave for them?
Yeah. No one has to suffer alone. We feel like we're alone, but no one has to suffer alone. If you call 988 and that's the only thing you call, it's designed just for that. If you feel like you have nobody. But I would always tell people, if you can count on both hands, those you love and trust the most, you're doing pretty good in life. Reach out to one of those, or reach out to me. My email's simple. It's www.thetoughesttopic@outlook.com.
Okay.
Send me an email. Reach out to me on LinkedIn. LinkedIn is the only social media profile that I'm active in right now. Send me a message. It still happens every now and then. And I continue to partner with experts across the country, all over North America, to help me keep this, fresh, because I like different perspectives. But no one suffers alone. And nowadays we're training first responders how to respond to mental health distress. So call 911. It takes a lot of courage for somebody to call a complete stranger and just unload on them, but that person is highly trained to figure out where you are, to let first responders know, hey, they're on the side of the road. They're in between Cochrane and Calgary, in this parking lot, in this theater. That's where they're at. They're driving this kind of car, and then they know they're responding to distress. They're not responding to crime. I'd like to get all law enforcement agencies to realize that you're responding to distress, not a criminal act. Okay. Even if they're armed for themselves, not for you. And if we do that, if we reinstill that in humanity, we'll have less school shootings. We'll have less violence out there on the streets. We'll bring back our humanity to say, hey man, we're in this together.
Yeah. We
truly are, because you have people who depend on you. I have people who depend on me. We have to tell people that, hey, there's people in your life that need you, that want you, that love you. Like when I talk to some of the guys before we hang up, like if it's Randy or Chevy, love you, brother. We shouldn't feel ashamed as a guy or man to say, I love you, man. Like, I know I love you. We never met. When I got immersed into this circle, despite how it all came to be, dare I say, Satan Hill, but, when it fell apart, we were like, no, man, we can't let this die. We got a good thing here. And it wasn't for money. It was, we are all over the North America, in New Zealand, able to affect change in our circle of influence. So that's why I tell people, I said, you are able to affect change in your circle of influence. Be the instrument of change.
Yeah. My last question.
Yeah.
Are there telltale signs that somebody might be considering taking their lives or going through something to look out for? And how would you respond to that?
So the top 3 reasons haven't changed in decades. The first one is a relationship failure. A boyfriend, girlfriend thing, a marriage, whatever it might be. Next is financial issues. And the third are legal issues. Now, what I tell people is those 3 elements always seem to coexist. You never have one without the other.
Right.
Right.
I'm familiar with that. Yeah.
Yeah, me too. So those are the top 3 of why people want to do this. And in like the financial one, someone's like, oh, so if I'm not a millionaire, I'm going to kill myself. I said, no. That's not what I meant. It means you're having a financial trouble that at your current rate of pay, you can't fix it. You're not even treading water. You're going down for 5 to 10 minutes, coming back up for air, and someone's getting a bucket in the ocean trying to help you. or that's how you feel. That's what I mean. Legal issues, you got in trouble, you did something, whatever it might be, a relationship falls apart and you pour. That's probably the number one for the most part, especially with young people, is because they'll pour so much emotion and time and feeling into that relationship, investing so much, and then when it falls apart, like, she got ripped apart.
Yeah.
It's comparable to when a woman gives birth and she has been connected with that human emotionally for a very long time, and it's gone. Then it's like they feel a loss. Postpartum, right? They feel that where's that emotion? When we dump that much into a relationship, that's kind of how it feels. You just ripped my heart out. Again, the neurons being connected to the brain, and then dealing with it again, going back to the accountability of the individual. It's very rare that I've come across somebody that says, "Hey, this happened to me. I did nothing." Okay, it's possible. It's possible. So you say, "Okay, what can you do about the relationship?" And I had a kid, a young soldier. He got exposed to all three in one night. He was messing around on his wife, got caught. Whose fault is that? That's him. Then he tried to race his wife home for some reason, gets pulled over by a local police department. He's been drinking. Boom, DUI. Okay. And then by the time he gets home, the next morning, wife is gone, cancels all the checking account stuff because she was the breadwinner. She was making more money than he was. And then done. Everything. She's out. So in one night, all three elements of relationship, finance, and legal hit him, because in less than 3 months, he was kicked out of the military because you can't have a DUI and maintain a secret security clearance. So his life fell apart inside of 3 months. So yeah, we watched him very closely. And that was another mechanism I put in place, is those who we knew were going to be at risk, we watched very closely.
Yeah.
So if someone's experiencing something like that, make the call. Mondays, we call it Buddy Check Monday. We'll reach out to a guy that you served with. How you doing, brother? I've done it. When my dreams hit me hard, I know there's a group of guys in this valley that I can call right away. And when they see my number in the middle of the night, they don't hesitate. And then teach people coping skills. So I have 3 levels of coping skills, and it usually stems from the bad dreams. And it's not because of regret. I regret nothing, man. Just know that. Okay. Violent as it was, I regret nothing. That's what I was called to do. But the demons still haunt. So usually, most of the time, if I have a dream, I may not even wake up. My wife will just tell me the next morning, "Hey, you're kind of jumping around a little bit. I rubbed your arm or rubbed your leg, and you fell right back to sleep. No big deal." I'll wake up. And if it's a bad one, I'll tell her a key detail of the dream. And she knows exactly what I mean. So if I can't go to sleep right away, I'll go grab a bowl of Frosted Flakes, put on Friends or Seinfeld, something that's just, mindless and comedic. And half an hour later, I'm back to sleep. The Frosted Flakes is actually a key component that I learned from a psychologist who said, "Hey, when you have bad dreams, your brain will rob the body of glucose, the sugar."
Yeah.
So yeah, it's artificial sugar. It's not the best for you, but within half an hour, boom, it's back in my brain. I'm okay. I'm back to baseline. Go back to sleep. If it's really bad, I'll tell her, "Sweetheart, I can't go back to sleep right now. I'm just going to turn on the TV and sit here. Or I need to go for a drive and listen to music." Music is my best treatment, period.
Yeah, me too.
Good rock. I'll just get in my truck, hit my playlist, middle of the night. It's quiet. It's nice and cool. There's hardly anybody out, and I can just drive. She doesn't say, "No, I don't think it's a good idea." She'll say, "All right, drive safe." And then there's no pressure. And that's another thing I'll teach, for like relationships, boyfriend, girlfriends, husbands, wives, whatever. Don't press the issue. Wait for them to come to you, because they will. If there's trust there and there's love there and respect, they will come to you and say, "Hey, I know it's been like 12 hours since I had that dream. Can I talk to you about it?" Because you got to be prepared for that, especially if you've got work to look forward to. You got to separate, compartmentalize that emotion, that response. And then when they're ready, they'll be ready. Don't press the issue, because that puts so much pressure on somebody to say, "You need to fix this and you got 10 minutes.
Yeah.
Don't do it. There's no time limit on healing, and you may never heal from a certain trauma, but you'll know how to, I'll teach you how to respond to it in a healthy way, and if when someone says, "Well, I don't open up about feelings." Okay, I'm patient. I will sit there and stare at you and ask you a lot of incriminating questions. You'd be like, "I'm not moving. I'm not leaving, dude. I'm here for you. You are what is most important to me right now. What do you need from me?" "Well, can we go for a drive?" "Sure, let's go for a drive." "Can we go get a beer?" "Let's go get a beer, man." So, and that instills trust. And I think that's what's missing. I think we violated our trust with so many people that, if you violate it once, it's long lasting. And unfortunately, man, I think it still happens to where someone's first impression is their lasting impression of someone. Anybody can improve. Anybody can do better. Anybody can make a difference,
So it sounds to me like the main thing you could do is just to be present, listen, and just be supportive.
Absolutely. And say, okay. And you have to know where the level is, because if you know it's serious, you say, you know what, I really think we should go to the ER. Can I take you? And I will stay there with you. And they say, you really think it's that serious? Yeah. Can I take you? Or can I call for first responders and I'll ride in the ambulance with you? I'm not going to leave your side until I am no longer allowed to. Can we do that? You'd be surprised, because you're reinstilling humanity. You're making it very clear that, like I said before, I know I sound like a broken record, but when you talk to somebody who is feeling like this, remind them that you are what is most important to me right now.
Yeah.
Because it's suicide first aid. We're not talking about long-term care here. The whole foundation of what I teach, it's suicide first aid.
Yeah.
If you know how to take care of a broken leg in the field, on the street, accident, whatever, great. Are you going to reset the leg? No, you're going to send it to a higher level of care. You need to know how to do that. You need to know what resources are in your area. So every time I teach a class, I know what resources are available in whatever city I'm in. I say, hey, do you guys know about the hospital? They got the 14th floor. Oh, yeah, okay, good. This is suicide first aid. All I got to do is keep you from the access, if that's the way you're going, or keep you from the thoughts without acting on the thoughts. Share them with me. Be vulnerable. Oh, man, that's people's biggest fear. Their first fear, number one, speaking in front of a group of people. Number two, death. Number three, showing vulnerability, because they think it's weakness. It's not true, man. It's not true. I'll cry.
Yeah, I've cried recording this podcast. So,
you have to be allowed to do that, because if you can get pissed off and hit a moment of rage, then the flip side of that coin is you could probably cry in front of the same person you got mad about or mad with. You can. It's a primal emotion. Like, what's his face? His gold primal. Our most primal emotion is anger. Yeah, Fontana. Yeah. Shout out to Chris, man. You have to be able to be primal in your emotions.
You wake up today, you go today. Yeah.
Right. Damn straight.
Well, I think we touched on a lot of good stuff, Craig. Anything you feel that you haven't gotten out that you want to say, or any last words of advice?
No, I mean, I mean it when I say, if you need help, you want me out there, you want me to teach a class, whatever, for wherever, reach out to me. I'll make it happen.
Yeah, I'll be sure to share your LinkedIn and your email in the description. But yeah, awesome, Craig. I really appreciate you coming on and talking about this.
Well, brother, thanks for having me on, man. You do good stuff. Seriously, I watched your stuff, and then some of the subjects, if you really pay attention, they really get you, because there's always somebody out there feeling how we're describing.
Yeah.
And I'm hoping that there's people watching right now, or when you upload, or how it works, they're feeling like that, and they could hear that, oh man, there's a complete stranger who said exactly what I'm feeling. Okay, let me reach out to him. Let me start typing away. You don't know me. I lost count how many times that happens. You don't know me, but I'm like, cool, I know you now.
Yeah. Well, I'm hoping to reach a lot of different audiences, covering a lot of topics, because I do believe in the power of shared stories. Like, everybody goes through different things, but there's commonalities and parallels, and that are relatable, right? So I think it's important to, like you said, be vulnerable and share, and just be there to support one another, man.
Yeah, because they will say things like, this is the worst day of my entire life. And I'm like, no, it's not. Your next worst day is coming. It's going to be awesome. And you're going to know how to deal with it, because you've made it through this one. So yeah, man, I'm in. I dig it. Thanks, man.
Great. Yeah. Anytime. I appreciate you, man. See you later.
All right, brother. Later.
Take care.